Good afternoon. You're with me, Tanima Biswas. Our top story. With COVID cases under control, a key COVID task force member, Arora, has revealed that India will soon release a policy document on administering a third dose of COVID vaccine. The document could be released within the next 10 days and will spell out eligibility category for third dose. This comes at a time when several reports suggest that people are secretly taking third booster shots. Remember, at the Times Network Summit yesterday, Union Health Minister said that while priority right now was to administer 2 doses to every Indian, but he also added that experts are being consulted over the booster shot. Listen in. In fact, we will take you through what Mansukh Mandavia, the Union Health Minister, said yesterday. But of course, as you can see, that this is one of the main focus points now in terms of policy making as far as vaccines are concerned for the centre. And the task force member also, Mr. Arora, in fact said that there could be a policy on booster shots soon. I'm joined by Dr. Sanjeev Bagai over the phone line. Dr. Bagai, thank you so much for speaking to us here on Mirror Now. If you could just also tell us that this is something which has been a debate point for quite some time now. There have been several people who have already said that they have taken a third booster shot. But in the current context, when the government is still aiming to ensure that everybody in the country has those 2 vaccine shots, which is currently what the government's policy is something like a third booster shot imperative for the government to consider at this stage?
Good afternoon. So there are 2 points in this. Our first aim is, of course, to give the maximum number of shots as the first shot so that the acute and severe infections and death is immediately curtailed, which we've been very largely successful. And the second aim is to make the almost 85% coverage of full vaccination, which at the present moment is termed as 2 vaccines. The worldwide data, which has mainly come from Israel and US and UK, has unequivocally shown that the 2 vaccines are insufficient to give the adequate prolonged. So just allow me 30 seconds and very quickly to explain. The natural immunity post-COVID lasts for anywhere between 5 to 7 months, and the durability of the vaccines starts waning between the 5th and the 7th month. The antibodies which are routinely being checked are surrogate antibodies and are not the accurate way to check the durability, because there are different types of antibodies. Antibodies against the receptor binding domain, against the N-terminal domain, and so on. But the overall data worldwide has shown that 3 shots are required. In fact, there are now studies and research work showing that the third shot should not actually be called as a booster because it is a part of your primary immunization. So as a summary, the vaccines overall worldwide are now recommended as 3 injections, dose 1 and dose 2, which was earlier considered as full vaccination, followed by a third vaccine to complete the vaccination anytime between the 5th and the 7th month after your second shot. This gives a very long-term immunity for almost 250 to 300 days after the third shot to well protect you.
Dr. Bagai, as we said that, there's of course, we'll have to wait and see what the government has to say about this. Government experts currently suggesting that maybe in 10 days we'll come to know. But do you think that a policy needs to be ready in place to be rolled out? Because it's going to be a year in January that the national vaccination rollout that we have seen, which started from January 16 this year, is going to complete its 1-year term by early January. So in that framework, is that a framework that we should be looking at by which the government should be ready in terms of whether or not a third booster shot, or as you said, that it could be the third shot of the vaccine, not just the booster shot, that a decision should be taken by then?
Yeah, so I think the entire concept note of the third shot, which shouldn't actually be called as a booster because it's a misleading terminology. The third shot is required. CDC in US has already recommended it formally in its list of guidelines, in which it has mentioned not only above 65 or 50 years. In fact, they have mentioned anyone above the age group of 18 with comorbidities, and above 60 to 65, for sure you need to get it with or without comorbidities. This gives not only your your antibody response, which is very good and durable after the third vaccine, but it also gives you a very robust T cells, which is CD4 and CD8 markers, which prevent severe disease and death. So therefore, I think this is important at this stage that India forms its own guidelines. Three things will have to be kept in mind. One is, of course, we'll have to have a pan-India rationalization of a seroprevalence survey to check. Second is to prioritize which are the patients or which are the index candidates which will require the third shots on priority. The people who are immunocompromised or extremely clinical vulnerable, patients on hemodialysis, chronic kidney disease, liver disease, or on immunosuppressant therapy. So those will require it first. And of course, the extreme elderly. And we should have a policy in place soon. It will depend upon the total supply. And again, the entire machinery will have to be geared up the way we did for the first shot and the second shot, including the data monitoring and long-term seroprevalence. So the most important thing is we need to maintain the data to see how the patients have reacted after the second vaccine and now after the third vaccine, to keep in mind that this may become endemic at some point of time, and we would require an annual COVID shot, very much like we give an influenza shot or many other vaccines.
Dr. Sanjeev Bagai there, thank you so much for joining us on this very important discussion in this broadcast. Let's also listen in to what Union Health Minister Mansukh Mandavia had to say on this issue yesterday.
मनसुख जी, लोग ये भी जानना चाहते हैं कि वैक्सीनेशन हेजिटेंसी थोड़ी, आपने भी जैसे कहा कि है कहीं लोगों में, जब वैक्सीन हेजिटेंसी है और वैक्सीनेशन इतनी तादाद में अवेलेबिलिटी है, तो क्या इस वक्त बूस्टर डोज लगाना चाहिए लोगों को? इस पर बहुत चर्चा है आम आदमी में। आपकी सरकार का क्या कहना है?
ऐसी चर्चा स्वाभाविक तौर पर होगी। हमारा मकसद है कि देश में पहला डोज और सेकंड डोज देश की जनता लगा ले, और एक्सपर्ट ओपिनियन जो ही बनेगा, ये सब चीजों में सरकार कोई सीधा एफर्ट करे ऐसा मैं नहीं मानता हूं, क्योंकि ये सब बायोलॉजिकल विषय के साथ जुड़ा हुआ है। उसमें जब देश के आईसीएमआर और एक्सपर्ट टीम है, उससे जो भी राय आएगी, जब वैक्सीन मैन्युफैक्चरिंग, वैक्सीन रिसर्च, वैक्सीन अप्रूवल, ये सब चीजों में मोदी जी ने एक्सपर्ट ओपिनियन पर ही डिपेंड किया है।
कोई चर्चा आपके डिपार्टमेंट में, हेल्थ मिनिस्ट्री में है कि बूस्टर डोज की एडवाइजरी आप कब जारी करेंगे?
ये जब, जैसा मैंने आपको बताया, जिस दिन, क्योंकि मेरे पास पर्याप्त मात्रा में वैक्सीन है, इंफ्रास्ट्रक्चर रेडी है, देश की जनता ने 80% देश की 18 एबव एज की जनता ने फर्स्ट डोज लगा दिया है। उसका मतलब यह है कि दुनिया की सापेक्ष में वैक्सीनेशन का हमारा परफॉर्मेंस बेस्ट है। हमने 80% फर्स्ट डोज एडमिनिस्टर कर दिया है, इसलिए मुझे विश्वास है कि भविष्य में कुछ भी करना पड़े तो हम कर सकते हैं।